Many doctors are now regularly testing patients to see if they have the coronavirus, and if confirmed, health officials might try to trace other people the patient may have come in contact with. In the best case scenario, those people are also tested, as are the people they may have come in contact with. It's a testing and tracing cycle that is all too familiar to health workers. And while all of this is going on, scientists worldwide are working on a COVID-19 vaccine. And all of these steps are intricate, and the high-stakes nature of each step is essential to saving lives. This is the focus of our show today: testing, tracing, and the race to develop a coronavirus vaccine. But what is at stake for Africans? And how do long-standing stigmas about diseases and vaccines impact how we see the ongoing work to create a vaccine for the coronavirus? Hello, I'm Ayen Bior, and we begin in South Africa, where a biotech firm is seeking to plug a gap in the country's coronavirus testing capacity, which is undermining efforts to respond to the COVID-19 pandemic. Reuters journalist Okwi Okwo reports.
It's the African country hit hardest by COVID-19, and a shortfall in testing capacity has further undermined South Africa's response to the pandemic. But in a laboratory in Johannesburg, scientists are packing up test kits in a bid to plug the gap. Cape Biotechnologies, led by Chief Executive Daniel Ndima, says it plans to roll out up to 5,000 test kits per day from the end of July.
We knew that South Africa and the entire continent basically relies heavily on imports, and we knew that because of the pandemic, our country will struggle to get the test kits. So we said to ourselves that we need to stop doing what we were doing and just work on COVID-19.
The WHO has warned that a shortage of test kits is a challenge for the continent, and in South Africa, the situation is exacerbated by a weak rand. That's meant spending more on imports, further straining an already stretched budget. With 100,000 confirmed cases already, the government is expecting an escalation ahead of an anticipated peak towards the end of the summer, especially in crowded townships. As of the end of May, there was a backlog of over 96,000 unprocessed specimens awaiting testing, according to the Health Ministry. But at 5,000 kits a day, Cape Bio, which was spun out of the Council for Scientific and Industrial Research in 2018, could meet approximately a tenth of South Africa's current daily testing rate.
We are able to achieve results faster.
Ndima also says Cape Bio's test kits produce results quicker than those being imported, within 2 hours compared to 4 to 5 hours. He added that Cape Bio, with a team of 11, will supply the kits to the government, but is also seeing demand from other companies globally.
From South Africa, we go to Burundi, where the country's new president is declaring the COVID-19 virus the country's biggest enemy. It's a major reversal for a nation that has largely ignored the highly contagious disease. My co-host Ariane Itangishaka has the details.
Former President Pierre Nkurunziza, who died suddenly last month, and current President Evariste Ndayishimiye had until now overlooked the gravity of the coronavirus pandemic. Burundi had a full-blown campaign ahead of its May presidential election, but unlike its neighbors, which had imposed lockdowns and curfews, had taken a few steps to combat the spread of the virus. However, now President Ndayishimiye is considering COVID-19 a serious threat.
I confirm that the coronavirus pandemic is the greatest enemy of the Burundians because I see that all the people are afraid of this pandemic.
Burundi has fewer than 10 technicians capable of carrying out the tests for the virus, according to AFP. The country is reporting 191 coronavirus infections and 1 death, according to Johns Hopkins University. Speaking after the swearing-in of his new government in Parliament, Ndayishimiye says COVID-19 is a huge priority for this administration.
From now on, we are starting a campaign against the pandemic in Burundi under the theme, I heal, I don't contract, I don't contaminate.
Ndayishimiye is calling on citizens to strictly respect all preventative measures. He reminded citizens that coronavirus tests are free and treatment is free, warning those who did not get tested when they had symptoms. Ndayishimiye promised testing centers will be installed and testing campaigns launched across the country, a high-ranking health ministry officials told AFP. on conditions of anonymity. That reversal comes after the World Bank donated $5 million last month to help Burundi fight the virus. At the moment, Burundi has more than 7 testing locations, which includes government and private hospitals, as well as temporary regional testing sites. Now let's turn to Nigeria. More positive news on testing as the cases of the coronavirus continues to spread. The country's Center for Disease Control is fighting back with aggressive testing. The NCDC says it aims to test millions of people in the coming months. To achieve this, it is expanding its workforce and collaborations with the private sector players. Timothy Abwezu reports from Abuja.
An extraction process for COVID-19 samples ongoing at the National Reference Laboratory in Abuja, one of many labs set up across the country to test for the coronavirus. In this room, lead virologist Adama Ahmed and her team of medical laboratory scientists prepare samples before they're transferred into the machines for testing.
So we are having 2 shifts now, day shift and night shift, to make sure that testing for COVID-19 is continuous. As they have, embarked into, community screening now, a lot of samples are coming into the laboratories.
Nigeria was among countries in Africa that initially recorded low COVID-19 testing. In May, when President Muhammadu Buhari relaxed the 5-week lockdown, only around 11,000 tests had been carried out. But recent count shows over 185,000 samples have been tested so far, a significant jump from previous figures.
We are using every machinery that we have. We have deployed the throughput machines that we talked about at the beginning, the one that can test up to 3,000 samples in a day. That's the Cobas. We have the Cobas. We are using the Cobas. We are using the Abbott platform. We are using the GeneXpert in addition to the regular open platform. And we have optimized more labs than when we started. In June alone, we were able to optimize 14 labs.
The Nigeria Center for Disease Control, NCDC, is also leveraging on inputs and support from private sector to reach more people with testing. A private sector-led coalition against COVID-19, CACOVID, was launched in March to provide funding to accelerate coronavirus tests and treatments. Non-profit groups such as Flying Doctors are also helping provide mobile testing facilities for COVID-19.
It reduces the need to continually change PPE because obviously they don't have that direct patient exposure. And we've noticed, because they're not so worried when they're testing and so sort of conscious, that actually also improves the speed of testing.
But despite daily records of new coronavirus cases, there is still widespread disbelief.
For me, I'm not trust the coronavirus day for Nigeria. Because of some country, coronavirus day. I'm about this Nigeria, no coronavirus. Some people where the leader, the Nigeria people, they take the thing like business.
Nigerian authorities are targeting 8 million tests within 1 year, but say global scarcity of test kits and a widespread disbelief in Nigeria could stand in the way of achieving this goal. Timothy Abwezu for VOA News, Abuja.
After the break, a look at why experts say contact tracing is essential to controlling the virus. Stay with us.
Being part of Our Voices is about more than just sitting here and talking about women's issues. It's about listening to them
and bringing their opinions to the table and making sure their voices are heard.
Because our lived experiences, our stories, and our voices will help shape the next generation. Welcome back. You're with Our Voices. We're taking a look at testing, tracing, and the work to create a vaccine for the coronavirus. Contact tracing is a vital part of combating the virus. But what is it? How does it work? And how important is it toward the elimination of COVID-19? To get these answers and more, I reached out to Last Mile Health, a nonprofit group that led contact tracing initiatives in West Africa during the Ebola outbreak.
Like firstly, we learned that early detection is very key to breaking the chain of transmission. So when contact tracing is employed earlier on during any outbreak, it's easy to break the chain of transmission and help to avoid overwhelming the health system. So that's one. And then contact tracing cannot be done in isolation of other interventions. Because if you contact trace and you determine your case, you need to go to the next level. So there are other strategies that should be employed together. So you need to have a strong referral pathway in place to be able to refer patients safely to the treatment units. You know how rapid testing capacity to be able to confirm cases or to diagnose them, to be able to ensure that if someone has the virus, they are quickly taken away and treated, and those who were just suspected or maybe they have other conditions, to take them back into other health facilities for treatment. So those facilities have to be in place.
I know that it's important to wear masks and to keep social distancing and to do really anything to protect yourself against COVID-19. But is there anything that individuals can do to help contact tracers? For example, would it make any sense for me to carry around a notebook with names of people that I came in contact with just in case I get sick? Would that make any sense? Is there anything else that individuals could do?
Yes, because our ability to contact trace depends on the information we get, from the patient, right? So if the patient cannot remember to tell us who all they came in contact with, that would be a missed opportunity. So individuals also have a part to play. Like you can document like your interactions with people and try to write them down and try to remember who you came in contact with, where did you go, so follow-up can be done. So those are really individual level support that we can also get from people who from like potential cases also to help to really track people who have come in contact with them and support us in ways that we can engage into so they can be monitored.
What would your advice be, to countries that don't have the infrastructure, as you spoke about?
So first and foremost, so invest in prevention activities, the risk communications. So that's why the risk communication pillar on the incident management system is very important. Ensure that we do awareness and make sure we communicate the risks around the ways in which the virus is transmitted. So social distancing, wearing of masks, and all those things to make sure that we have the measures in place. But we see that we are still carrying on the risk communication information, but we see increasing cases. So what can we do? Then this is where we need to ensure that we are detecting earlier. So contact tracing is going to come in, community engagement is going to come in here, and working with community members. We don't need to have sophisticated or like medical professionals that we need to have so much resource to recruit. But like I said, community members can be recruited and they can be empowered in a way that they can serve their community at the same time and also respond in a way that will be timely.
In the United States, New York State was one of the epicenters in the early stage of this battle. The state, with the support from Johns Hopkins Bloomberg School of Public Health and Bloomberg Philanthropies, designed a free online class to train contact tracers in the entire country. It turned out to be the conventional way of tracing interviews.
Well, to Africa, this is nothing new. So we reached out to Dr. Tashriq Ahmed. He's one of the leading epidemiologists on the team. We asked him how this program benefited from what African countries have learned about containing infectious diseases.
From HIV and STDs, which have been running disease or contact tracing programs for decades now and leveraging on that experience. But then also one of the key members on staff was Tolbert Nyanswa, who was the Director General of the Public Health Institute in Liberia and headed the incident management system during the Ebola outbreak. I myself was also the country director for Johns Hopkins in Liberia for 2.5 years, and much of my experience in contact tracing is also from the Ebola context. So I would say that the perspective of what was able to be done in Africa to strengthen health systems' ability to detect disease through contact tracing was very well leveraged into the coursework.
Now, Dr. Ahmed says contact tracers need special skills and traits to be successful.
The emotional intelligence is one of the most important traits for contact tracers. It's a presence of mind on the call. So it's attentive listening, how to be assertive rather than aggressive, how to respond and make sure that the person that you're talking to feels heard. So there's a difference between saying, I completely understand what you're going through, and saying, I hear you, I understand you, I see what you're going through. So the benefit of the interview-based process is that if someone says that they don't remember going out at all last week, you can then double check that. So we teach the contact tracers in the course, how do you ask prompting questions? Where did you eat? Where did you go? How did you get there? And between that back and forth, we help them remember and increase the ability for us to detect those exposures. I think this is another area where the examples from West Africa are very valuable, because one of the biggest techniques that they used there were to make sure that the contact tracers were representative of the communities in which they were contact tracing. So again, it wasn't that these were high-level government officials and public health officials who were going into communities. They were taking from those communities the community health workers who understood the context. So that, there's a difference if someone is Muslim, having a Muslim contact tracer, knowing to prompt them around Ramadan and Iftar, versus someone from a tribal community knowing what the rituals are that they need to ask about. That also helps build rapport in a way that doesn't need to is not so mechanical.
While Ebola and COVID-19 are both deadly viral diseases, Dr. Ahmed says there are important differences between the two.
Our best estimates is that Ebola is 10 to 50 times more deadly than COVID-19, but then spreads at a much lower rate and is a lot slower to spread throughout a community than COVID-19 can be. This presents different challenges. Both of them had an unprecedented scale within their context. We're seeing hundreds of millions of COVID-19 cases, but then Ebola was also an unprecedented scale in West Africa, and both of those require different considerations from the health systems to be able to sustain those types of programs. I think one of the biggest differences with COVID-19 is that people who are positive and symptomatic may not know it. There are many people who are positive that are unaware that they might be positive. Their symptoms are relatively mild, and so when they're contacted for contact tracing, they might not understand the severity of the risk that they present to the more vulnerable parts of society. So that communication to the public around the importance of compliance with contact tracing and keeping the community safe is definitely harder without that, the day-to-day impacts that they might not see because they're not feeling as sick as you would with Ebola.
Health experts say app-based contact tracing is appealing in part because the coronavirus spread is so stealthy. Infected people can transmit the virus for days before they develop symptoms. An Eritrean American has created an Android app called Tracker that tracks user locations and notifies them if they've been within a certain distance of someone who tested positive for COVID-19. For more insight, Africa 54's Paul Ndiho spoke to Beruk Habte, the creator of the contact tracing mobile application based in the U.S. state of Maryland.
Well, Tracker is a contact tracing app that's available worldwide on all Androids. And the way I came about it is South Korea was effective with their contact tracing app. And I wanted to ask myself, how can I do that while making it available for not just people in South Korea or just people in the States, but also people in every single country. Especially countries that are that can't afford to have this virus around, especially a lot of countries in Africa.
How different is your app from some of these apps that have already hit the market?
Well, for one, this app is very easy to use. Registration alone takes less than a minute to complete. You only need your name and email, and you're already in. There's no in-app subscription or pay for download. It's all free once you download it. It's available on Androids worldwide, but to make it easier, I always recommend that people go to the website, our website, which is www.letstrackcovid.com. And the best thing about my app, which is Tracker, is if that person who traveled from China to the States had Tracker, that Tracker wouldn't just notify everyone in China that person came in contact with, but it'll also contact everyone they came in contact with in the process, including in the States. That way, people can take their own measures at an early stage. We have a lot of users in Africa. I can tell you the countries, and Nigeria, Ghana, Sudan, Ethiopia, South Africa, and a few other countries just in Africa alone.
Have you tried to reach out to different research institutions, different states or governments that can potentially maybe partner with you and take this up to the next level?
Well, I'm actually in the process of doing that. And I really welcome that with open arms because, like I said, this is something that can benefit the world as a whole. And I think those health institutions or governments you mentioned could really play a huge role in that.
What a fascinating look there. We have to take a quick break, but when we come back, we'll examine the race for a vaccine and why some people across the continent are nervous about new medicine. Welcome back. You're with Our Voices. As the global COVID-19 death toll rises, so has a desire to find a cure for the disease. And for months, scientists around the world have been working to find a vaccine. But news of progress for a vaccine is not a welcome development for all. The COVID-19 vaccine trial in South Africa has been subject to some protests, and experts note a significant level of resistance and mistrust around testing on the continent. Africa 54 health correspondent Lenore Mudu spoke with Dr. Bartholomew Dickey Adkanmori, regional advisor for regulations of vaccines with the World Health Organization's Regional Office for Africa. He elaborates on the importance for Africa to participate in clinical trials.
Clinical trials are very, very important in helping to develop health products, products to either treat diseases or products to help prevent disease for diagnostics. Now, clinical trials by themselves are designed carefully, managed in a very controlled manner to ensure that products can be evaluated in humans as study participants, while at the same time ensuring that you're able to obtain the necessary data or information that is required for the licensure or of the product so it can be made available to many more people. Clinical trials have within them an inbuilt system of quality assurance, quality control, to ensure that they follow all the principles.
There is a growing resentment on the continent and really fear of clinical trials, and COVID-19 has highlighted many people's mistrust. As critics say, Africans are often seen and taken as guinea pigs during those trials. Talk to us about that. What is your reaction?
To tell you the truth, far from this, within the continent of Africa, the systems are in place. They are very effective in their reviews and the oversight that they provide for clinical trials on the continent. Now, gone are the days when clinical trials could be taken lightly and people could come from outside the continent, go into any country, a small town, village, and conduct studies on people. Now it is impossible to do that because each country has a national regulatory authority, and this national regulatory authority is mandate that the sponsors, investigators, fully comply with the requirements for a clinical trial. It's a mechanism to ensure that safety of the participants is assured. And there are ethics committees as well, which are well organized. They have the capacity to review clinical trials and also provide their approvals and at the same time provide oversight.
I was listening to a patient who enrolled in the clinical trial for COVID-19 here in the United States, and she was talking about the type of scrutiny she went through in terms of her health, the type of tests that she had to go through, and how the researchers and everybody involved was taking care of her in very specific detail. So there's a clinical trial ongoing in South Africa right now, which is in collaboration with Oxford University. What is the process with people in Africa with these trials? To how much care, how much scrutiny, how much assistance do they receive during the trials when they participate?
Let me first begin by saying that clinical trials should be the same regardless of where they take place, because there are international guidelines, there are international commitments on human subject research. Now, the standard of care may vary from developed countries to low and middle income countries, based on infrastructure, based on the availability of specialists and experts to look after patients or subjects. That is understandable, but within a country, you cannot deny research participants the basic standard of care which prevails within that country. And I expect that in South Africa, that the investigators will abide by this. They also have the benefit of the guidelines which were developed by the African Vaccine Regulatory Forum, or AVRF, and other guidelines by the World Health Organization to ensure that they comply with the basic requirements of clinical trials as it pertains all over the world.
As always, thank you to Lenore for your excellent reporting. And that's all from us today. On behalf of my co-hosts and on behalf of the Voice of America, thanks for watching. Good day.